All righty. Well, welcome to our second fast track orientation call. This is super exciting because on Monday, you get added to the main Facebook group and they've been waiting for you. So this is going to be really good. And the purpose of the purpose of this call today is we're going to be looking at your business idea. And the whole idea behind this is to determine that this is something that is profitable. This is something that has the potential of scaling and all of that stuff, so that when you start working in the school, you're clear on what you're working on, right? So last week we did a lot of mindset stuff. And we also looked at how you get the most out of the school, because I want you to go in with that attitude that I'm going to 10x, 100x my investment here. I'm going to totally change my life. Like, you go in as a total boss in control, right? And then today, what we're going to do is like help you go like, okay, this is my business idea. Boom, I'm done. So when you go in, you can hit the ground running. Okay, because I don't want you to have to spend like the first 6 months trying to figure out what it is you want to do. You can decide on something and then we can start going. So that's kind of what's going to happen here. So in true EBS fashion, before we actually start with the content, I am going to ask 2 or 3 people to put their hands up and share wins. So between last week and this week, any wins you've experienced in your business, anything you've done differently, any big mindset shift for you, and because of that you acted differently, any of those, will start from there, and then we'll get into what we have for today. So who wants to go first?
I was pretty excited that I sent in my trademark registration application to try to trademark the name of my business.
Love it. Okay, so that's already sent in, so it's just cooking at this point, if we may.
I sent it in today.
All right, strong work. All right, beautiful. Now, is this for your business that already exists, the trademark?
No, this is the one that the business that I'm preparing for.
Got it.
Like I'm creating it in my current practice, so when I leave this practice, so
That's
it'll be Weight
done.
and Gold.
Okay.
And so I just wanted to go ahead and trademark that Weight and Gold name.
Love it. Love it. Good stuff. Congratulations.
Thank you.
I love it. Okay. Who else? A win since the last time I saw you. Yeah. This is a muscle. We will develop it.
I'll share one.
Hi, Dr. Fanwa.
Hi, I'm feeling under the weather. So I reached out to a podcast that I really enjoy listening to called Ologies.
Okay.
And I was like, oh, I want to be on your show because I'm a urologist. I don't think you've ever had a urologist. And I kept bugging them and they finally responded. So I'm going to be on it hopefully next month.
Yay!
But they were like, oh, we finally got it. We'd love to have you. So.
Oh, that is amazing. Congratulations. I love it.
Thank you.
Love it. Okay, that's great. Super, super awesome. I will tell you something about podcasts. So podcasts are like business assets. I had someone reach out to me. She's like, Dr. Una, you won't believe what just happened. I'm like, I guarantee I will. What happened? And she says, I was on your podcast a year ago. So somebody reached out to me, was like, oh my goodness, I listened to your episode on the EntreMD podcast. And she signed up for my program, and it was a $12,000 program. But she did that a year ago, right? And so the thing about podcasts is they live on. People can listen to it whenever. You know what I'm saying? And so the rewards are, it's more long-term. There will be some short-term, but it's more long-term. And the more you do it, the more it snowballs. It's just crazy how podcasting works. So that's amazing. All right. So one more.
I can share. I'd love to share.
Yes.
I actually am kind of divided. So I joined EntreMD because I wanted to grow my private practice, but I've also found myself kind of tethered in mentorship for young female podiatrists. And so what seems to dominate my mind is providing information of value to young podiatrists. And so I was able to sign on 2 mentees in the last 2 weeks and kind of work them through coaching and preparing for residency. And it just like, I'm constantly at a divide. So I'm trying to like reframe and focus, but one just comes more natural than the other. And so I think that's a win, but I think I need like to work on some stuff too.
Yeah, so it is a win, and congratulations, right? So let's put it this way. I'll tell you the model that I've used and the model that I'm fond of. With a practice, you want to, we don't kill cash cows. I think that's the easiest way to put it, right? And I'm not saying you're trying to walk away from your practice or anything, but we don't kill cash cows. What that means is you grow it, you can do the mentoring thing, but you remember what's number one and what's number two. And as you build this to work bigger and better without you, you can do more and more of this. Does that make sense? Otherwise, you have to put the new business under pressure to take care of financial things and all of that, but it's a newborn. You know what I mean? Newborns don't pay bills. You see what I'm saying? Mm-hmm. And so that's something that you can do. So it's a dance in a way. But there will be that tug like, oh yeah, you know, because the new thing is more exciting, right? So there'll be that tug to kind of, you know, walk away, but you want to make sure that's taken care of and it can work without you before you do.
Yeah, I think I'm just like, when I'm discouraged, I'm trying to find that distraction.
Yeah.
That's where I'm at.
Yeah. Cool. And the thing is, those, especially like in private practice, you're going to have those hard times that show up that will make a lot of other things look great. But just remember, for the people that you want to help, like if I have a challenge in my private practice, one of the things that'll make me better able to do what I do in EBS is taking that challenge head on and figuring it out, right? Because that challenge, the people that I help are going to come to it. So that's just me flexing my muscles. So when it's their time, I know how to help them. You see what I mean? And so that's the way I kind of reframe it. And so a challenge, I'm like, if I'm having this challenge, like 45 other people are having this challenge right now. So I need to figure a way out of it so I can help them too. Yeah. So it's a wonderful world of entrepreneurship. Welcome. Okay. All right. So great wins, really great wins. So what we're going to do today, you guys remember your homework from last week? Do you guys delete it from your minds? Who remembers the homework from last week? Who did their homework from last week? It's like, Dr. Una, I have it written. Look at it right here. Oh, come on, people.
Attempted. I'm in lots of quandaries. So anyway, yes, I'm aware of what the homework is.
Okay, see, I have 1 out of 11. Come on, people. You guys hurting my feelings? Huh? Okay. All right, so this is the deal. Okay, Dr. Fan was like, look, I have my stuff, okay? I have my stuff. Okay, what we're going to do is I gave 5 questions to answer, right? So what is my business or my business idea? Who do I serve? What is their primary problem? What is the outcome I offer them? And it's fine for it to just be the opposite. It doesn't have to be fancy. None of this has to be fancy. And then number 5, what is my business model? Which is basically, how does my business make money? Okay, so if I were to give you an example, my business is business coaching. Who do I serve? Physicians. What is their primary problem? Businesses aren't making money. What's the outcome? I help them, what's the outcome I provide for them? Profitable businesses. What is my business model? A coaching service, right? Or a membership, I can call it that, right? Okay. All right, we're gonna have more shares. I love it. Okay, so but do you guys see that? If I had a private practice, well, I have a private practice. Okay, so what's my business? A pediatric practice. Who do I serve? Parents. And this is important because my client is not the child, is the parent. What is their primary problem? They have children with healthcare needs, right? What outcome? Healthy kids. What's the business model? Fee for service, for instance. Does that make sense? So it doesn't have to be perfect. There's no score for this, but the more you implement, the clearer it will get, right? So we're looking for your version that's good enough. So there's no pass or fail. There's no score. It doesn't need to be complicated. It doesn't need to be cute. I just need to ensure that there's clarity so that I know once you join everybody else and you start doing the things, you already know where you're implementing. Okay, I don't want anybody to be in a stage where they feel confused. That I don't want that for you. I want you guys to go in like, I got this, my mindset's right, I know how to get the most out of school, and I know what business I'm working on. Okay, all right. So I will let you guys raise hands. So we'll go in that order. Do you want to do it that way? So 5 of you want to unmute at the same time. So you can just raise hands and we'll just take it in order. And we're going to do everybody. So when you walk away, you're good. Okay. All right. So who's going? And it's boom, 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 boom. Okay. So boom, boom, boom. So we can get to everybody. All right, Dr. T, let's do you first.
I have a podiatric practice.
Okay.
So I serve people with foot pain or deformity or wounds.
Okay.
That is the problem that they have. The outcome is healthy feet so that they can stay active.
Okay.
Or not have an amputation.
Okay.
And my business model is a direct care practice.
Okay, so you're cash based?
Cash based.
Okay, beautiful. All right, so that is crystal clear. All right, so you know who you're serving. Why is this important? When you know this, then if you have to produce videos, you know who you're talking to. You know the problem they have, right? Like you're crystal clear on that. You know how you make money. You know how you can scale it. You can scale it by seeing more. You can scale it by upping your price. There's so many things you can do, but this is totally viable, totally works. So everything you learn from the business school, you're just going to funnel it through these things and just blow it up. Okay. So that's your business. EBS approved. Let's do it. Sound good? I think you might be frozen. Okay. So good. Yes. All right. Beautiful. All right. Dr. Fenwa, you're next.
Okay. My business is private practice, pelvic floor specialist, and sexual medicine specialist.
Okay.
How does it, who my client is or who do I serve? I serve all genders, 18 and up, presumably.
Okay.
My focus is women more than men, but I serve all. How do I make money? I will be a hybrid, potentially cash pay, potentially membership service, or, so that patients can get direct, more concierge medicine, and also like insurance out of network.
Okay.
Or cash stuff and insurance out of network. I will make money with office visits, surgeries. I want to do affiliates with product lines that serve my patients, lectures and appearance and media appearances. And potentially in the very, very, in the future, maybe work on creating own product solutions, maybe vaginal creams, supplements, whatever's that enhance or treat sexual dysfunction. What is their primary problem of I think I'm going out of order, sorry.
Yeah, that's okay, but you're getting it, so.
Yeah. What is the primary problem or solutions that I'm what are their problems? These patients have problems with they have pelvic floor dysfunction, pelvic floor conditions that involve incontinence, prolapse. They have sexual dysfunctions, including low testosterone and other hormonal imbalances, menopause symptoms. They have low libido, pain with sex. And then I want to also offer aesthetic services, aesthetic potential genital procedures. And the solution is basically expertise that they can get straight direct to them without going through the really unhelpful and long channels of traditional medicine.
Mm-hmm. So the outcome is for them.
Yes.
So what that means is they enjoy sex again.
Yes.
Yes. Peeing on themselves, like
okay, that's the outcome. Sorry.
To them. Yeah.
Got it. Yeah. So the outcome is they're more continent. They can enjoy sex, and they have less genital pain.
Okay, excellent. Now, so for everybody listening, what we got was primary and secondary business model. So her primary business model will be what she does with like either hybrid or insurance, right? Being paid for those office visits and surgeries. And then the secondary will be like affiliates and speaking and products ultimately and all of that. So it's fine for you to know your primary and secondary, but you need to get very clear on what your primary is, right? Because it sets the stage for everything else. Okay, so that's perfect. That's really great. And for everybody, again, think of it in this term, the more clear you are about all their problems. So every problem you describe is a YouTube video, right? Help, I pee on myself. Why? I thought sex would be fun. I did like all of that. Those are all YouTube videos that your person literally is looking for. Like that is what they're Googling. Right. And so the clearer you are about that, the clearer everything else is. That's why we're doing this exercise. So excellent. Great job. Please make sure you document it, keep it, remember it. This is important. Love it. Okay. Who's going next? See, this is evidence I don't bite. Come on, we can do it. Okay, Dr. Chibber. Okay, go for it. Oh, you're muted though.
So
there you go.
Okay. I actually have, okay, I have it written down, so I'm just going to. So yes. What is the business? Actually, I have two businesses, medical practice, which is two branches. One is a highly personalized lifestyle medicine-based primary care to members only. And the other one is the traditional fee-for-service care. One is profitable, the other one isn't. Then, of course, I have real estate, which is I own my own real estate and I rent to the above practices, and I have extra space waiting for a renter or a business idea, which can actually complement my personalized lifestyle medicine.
Okay. So tell me which one is profitable, which one is not.
So my lifestyle medicine based primary care practice is a members practice. It's concierge medicine practice, and it is profitable.
Okay.
The traditional primary care practice is losing money because we
you don't have the doctor, if I remember correctly. Okay.
I think 6 months we have not been able to get someone, but I have a potential candidate versus a potential offer to buy the practice. So kind of.
So we'll see. Okay. All right.
Yeah.
All right.
Okay. So how it makes money. I am an MDVIP affiliate. That's my concierge practice. It's through membership. 80% is through membership fees.
Okay.
And then other visits, fee for service for 20% or so. Then I also do immigration physicals, and I have a deal with the Indian consulate. So I have a lot of cash pay from them.
Okay.
The traditional practice is, of course, fee for service, which is the regular chronic primary care practice. And we're trying to do some things like CCM, RPM, things like that. But currently that's, again, as I said, it's not doing really well.
Okay.
It was doing really well before when we had the physician, but now it's hurting. Who is the ideal client, Phil? So for my lifestyle medicine-based primary care practice, these are patients who are really vested in their health, who are busy professionals, or elderly who needs coordination of care. So these are, because we offer same-day appointments, we have unlimited, like our appointments are as long as they need it to be. They have my cell phone. We do have travel plans. We have all kinds of things I do. Because I'm lifestyle medicine certified, I can create exercise programs, I can create meal plans. So, so my ideal client is somebody who's really invested in their health, or a busy professional who's looking for that kind of a service.
Okay.
Traditional primary care, of course, it's, you know, anywhere, it's all adult medicine.
Mm-hmm.
We want patients who are economically and geographically stable, and of course okay. Then I'm going to the next. What are the solutions we offer? So in the membership-based practice, I offer extended appointment times tailored to patients' needs, same-day appointments, doctor cell phone 24/7 coverage, coordination care with specialist executive physicals, which are about 3 hours, travel coverage. We have medical centers of excellence referrals, which is coordinated through MDVIP, meal plans, health coaching, culinary coaching. I do that to help patients stay motivated, lose weight, decrease medication needs, decrease urgent care and ER visits.
Okay.
So next is in the fee for service, of course, we try to do the same thing, same day, next day, phlebotomy, CCM, vaccines. Business goals, my business goal is to focus and grow the membership part of the business. And so that's the concierge medicine part of it, but I also want to have some lifestyle medicine based packages, which is available for the general public. So if the patient has a different primary care doctor, they don't have to join my concierge practice. But if they want to work on their lifestyle, I want to create some packages which they can work on. If they want to, say, work on diabetes reversal, or they want to work on the lifestyle medicine pillars. My other goal is to reduce the red money in the traditional practice, which is currently, hurting me. So either I hire an MD and DO to run it autonomously where it starts producing revenue, or I sell it off and then also divest it with real estate rentals. So again, I also have extra space for which I'm thinking to support the lifestyle medicine practice down the road. I'm going to start a yoga studio, maybe get some wellness, meditation, all that kind of stuff that can piggyback the lifestyle medicine, which the patients, if I'm telling somebody to meditate, if I offer some meditation classes, it will be easier for them to just go do that.
Okay. So this is really good. Okay. Now I'm going to just let you know this. There are two things that I want you to work on. One would be thinking about the outcome, what makes you different from the lens of your patients, right? Why is this important? Because as physicians, we're used to talking process. Nobody cares about our process. I cannot tell you how they do not care, right? And because you think about, if someone says, oh, if you come work with me, I'm a fitness trainer, I'll take you to the elliptical. And then after that, I'm just like, dude, just let me know that you put me in my skinny jeans again. That's what I want to know. You know what I'm saying? Like so when they come, so this is marketing message now. When they come, you do what you have to do, but when you're telling them how you help them, you want to take them all the way to the outcome. So think about it from their terms. They don't want to do the traditional, they want to do you. Why is that? What do they want? The clearer you can say that, and this is for everybody, the clearer you can say that, the more you get people to say yes. Especially important for you because you're cash pay. So marketing is going to be your bread and butter. You know what I mean? And all of that. So I want you to start working on that. And then also for everything marketing, embrace it like a rock star. Everything marketing, everything money mindset, embrace it like a rock star because it makes that model work. Okay.
So because I'm with this company called MDVIP, they do a lot of marketing for me. So they're doing my ACOs, they're doing Facebook ads, all that.
But are you at full capacity?
I'm not sure because it's they market all their doctors, right? So
no, what I mean is, are you seeing as many patients as you want to see, or you have room for more?
No, I don't. I only have about 190 patients. So I need to grow. So
correct.
Yes.
So they will do some.
Yeah, they did ask me to do social media like Facebook, Instagram, and I have not done that.
Yeah. So that's what I'm saying. Like for what your model works great, but your model works great when you learn to market. And we do a lot of that in EBS. So I'm not saying go figure it out. I'm just saying embrace it, even more so than somebody else would. Okay. Okay. This is good. Okay. Exciting. Maybe right. You'd be the #1 MD VIP doc, huh? How about it? Okay.
I will be.
Yeah. Dr. Lena, you're up. Then we do Dr. Panica.
Hello. Can you hear
Hi.
me? Can you hear me okay?
Yes, I can hear you.
Oh, okay, great. I'm in an RV, so all I hear is a lot of shaking. So I'm glad that you guys can hear me. So I just started what I'm doing and it's evolving as I go. But as of now, I am a lifestyle and obesity physician. And I work with patients who are in their 30s, who have or older, 30 and up, who have tried diet and exercise to lose weight, but they're unable to lose the weight. Okay. So the way I help them is right now I do like a 12-week program. I'm sorry if I'm jumping all around the place. I'm in the car and I didn't have my notes out with me. But as of now, I have a 12-week program where I work on both lifestyle changes and then I add in medications as well. to help them rev up or jumpstart their weight loss and then maintain their weight loss after that. It's a cash model that I have right now. And, you know, I just started last month and I'm trying to grow my business and kind of explain to people what I do, because I've had some patients not fully understand how I work and how I help them. During the 12 weeks, I'm available to them via text and email, and I meet with them my first visit with them is in the office, and I have an hour-long visit with them where I go through everything and go through their past medical history, talk to them about, you know, their obstacles and see what we can do to help with their lifestyle and make some suggestions at that time, as well as order blood work and discuss medications. And then I have weekly visits with them, which are through televisit. And then every fourth week, I see them in the office. So that's kind of my model that I have right now.
Okay. So your business is like, it's a lifestyle. It's like a coaching type.
Yes, it is. Yes, that's
And
correct.
then-
That's correct.
So you serve 30 and up who have failed diets. The outcome is weight loss and they're able to keep it off. And then
Yes,
your
yes.
business model is coaching, right?
Yes.
Yeah,
Yes.
okay.
Correct.
So again, like Dr. Chibber, we're gonna work marketing, okay? And we're gonna work it really hard because this is very workable, 100% workable, okay? So you can
Okay.
do that, you can scale it. It can be anything you want, 6 figures, multiple 6, 7, whatever you want. But it's a workable model,
Okay.
okay?
All right.
Yeah. So you are EBS approved, my friend. Yes, you are.
Awesome. Sounds
Okay.
great.
Yeah, love it. Great, great, great. Love it. You guys have like amazing businesses going on here. Okay, Dr. Panico.
Hi. So I'm currently an employed rheumatologist, but in the program to learn how to be independent. So eventually that's my goal. But my current business plan, so I'm a rheumatologist at an academic medical center. I make money by seeing patients fee for service or RVU model. My ideal client is adults 18 and over with either an established autoimmune condition, osteoporosis or gout, or they're coming for a diagnosis or evaluation for either of those conditions. My solution or what I offer them is diagnosis, treatment, care through prescription medications. And then we didn't really talk much about the platforms, but I'm planning on, I opened up a YouTube channel, AZ Room Doc. So I'm gonna get
right. When did you do that?
just this week.
Yes.
So it's up and I'm outlining my content, and then next week I'm gonna batch and do my first 4 videos.
Go for it. Okay, so outcome is in your client's mind. So it's not what you do for them, it's what happens when they work with you. So they worked with you. So this person has an autoimmune disease. They worked with you for 9 months. They are like, Dr. Panic, look, there is no other rheumatologist in this universe except Dr. Panico. Why do they say that?
Because I provide individualized care for them. So I try to tailor my approach to what they're telling me they need in the conversation between.
Oh, but hang up though, hang on. So, because you've gone back to the process, right? So that's what you do.
Yeah.
But they're telling their friend at a cocktail, like, I had this and I met this doc and my life has changed. And they're like, wait, what happened? So what did they say? What was the answer to that? Right? It's kind of the opposite of what their problem was, but what does it look like there?
So that I listen to them.
Okay.
And
so is there something like, well, they're in pain, then they're pain free, or they have control of their symptoms now, or like, how does life look different for the person?
yeah, so those things, I think, and then that they feel better.
Okay. So what I want you to do, and this will help with your content, and this will make people go, she's in my head. How does she know that? everybody here, your job, people are like, Dr. Una, get out of my head. I'm like, no, that's where I'm supposed to be. It's my job to be in your head. Okay. The greatest marketing messages interrupt the conversations that your ideal client is having in their head. Right. And so I want you to imagine you walking up and you're like, you know, you came from a family, mom had lupus, you were already always worried about it. You turned this age and you had that, you know, dreaded diagnosis and all of that. And but it doesn't have to be a dreaded diagnosis.
Right.
There are medications that can help. There are you know, things without medication that can be done to help you. You could have results like this patient that I worked with, who initially was scared spitless because she was like, my goodness, is my life going to be like my mom's? But then now she, you know, she doesn't have to live with the pain. I'm making all this up, right? I don't have to live with the pain, all this stuff. And she's in control because when it does flare up, she knows exactly what to do. And
Right.
you see what I mean? And so someone who is in that, is like, how does she know?
Mhm.
So you want that resonance, right? So what you have is good. I'm not at all criticizing what you have. But now I want you to start thinking in those kind of terms,
Mhm.
and start thinking about what your people are thinking,
Mhm.
right? Because as physicians, we think about what we do and what we do to help. Now I want you to go full circle and say, like, what are they thinking? Like, how did I help?
Mhm.
You see what I'm saying? Like, so you want to start adopting that. Even when people are like, Dr. Panico, you're the best. Now you want to know, why did they say that?
Mhm.
What triggered that statement, right? Or my life has changed or whatever, or I don't think I need to come back. Why do they say that, right? Because you fix them, they're good, they got, so what happened? What changed? So your marketing messages are like before and after pictures. You know, you see those on the internet, but said with words,
Okay.
not pictures. Yeah. So really good, really, really good. So I'm just inspiring you to start thinking, to start recognizing those things, because those are the best marketing messages. Those are the best videos, the best everything.
Yeah. And you phrased it much more eloquently. I took that approach with a patient today and she left like, oh my gosh, like, I'm so glad you understand what I'm trying to.
Exactly. And that's what you want. Every email, every social media post, every YouTube video, you want it to do that all day, every day.
Yeah.
Because then you're the leader.
Yeah.
It doesn't matter who knows what, you're the leader.
Okay. And I see such a difference in their response too, just by thinking that way. So
very good. I love it. And congrats on your YouTube channel. Okay.
Thanks.
When you
It'll
have
be
it
up
all.
soon.
Yeah. Once you have it all up, and let us know so we can shout you out, make some noise. Good stuff. Okay. And when you get into the business school, you meet Dr. Dada, Dr. Celine, Dr. Carlene Sue. They're a ton of rheumatologists, so you guys can do your rheumatology thing. Okay. All right. And Dr. Fenwa, Dr. Chanel, and Dr. Rachel Rubin, they're waiting for you. So yeah. Okay, who's next? I don't have any hands up. Come on, people. Okay, Dr. Golden. All right, let's go.
Okay, so I am a family medicine and obesity medicine doc, and my business approach, because I'm currently in a private practice, but transitioning over to only doing comprehensive weight care. So my patients are just any individual that is struggling to either achieve or maintain their best weight health. And the service I offer them is just comprehensive care and a long-term chronic condition approach to helping them achieve their best weight and maintain it. And how I'm going to make money. Primary is going to be just a fee for service private practice with plans to add on with like a membership membership service, as well as courses and build from there. And I think I already said the solution I offer them. So
yeah, I think you got it.
Yeah, I think that's it.
And so would it be fee for service? Like, so currently you're doing fee for service, but for the obesity part, is that going to be fee for service as well, or that's the membership?
So, I mean, I plan on, because 80% because my practice right now combined is full. I don't have capacity for any more patients, but I want to transition to only doing the weight health,
Hmm.
and that's about 80% of my practice right now.
Okay.
And it is insurance fee for service,
Okay.
and I plan to maintain that just because I don't want to abandon that patient population, my Medicaid and Medicare population that I can't serve
Hmm.
if I go to a cash-based patient,
Okay.
cash-based. And I'm also a hospice medical director that I would have to give up if
Okay.
I had to opt out of Medicare, and that's just not an option for me.
Okay.
So the membership, I was planning on doing more, creating a website that I'm working on, Weight and Gold, and mainly like a coaching, weight health education, monthly subscription with like recipes and nutritionists and guidance for that they could participate on to capture patients beyond clients rather than patients. So
Okay. Yeah. And so that's fine. So two things. One is, and this is for everybody, if you're doing a private practice and you're doing fee for service, in a way, compared to cash, there's going to be a little bit of a volume game there. And that is fine. You just have to recognize it, because sometimes I see people try to fit concierge medicine into a fee for service model. And I'm like, yeah, that's kind of tough there. But at the same time, it doesn't mean not good care. It just means we streamline so we can do an excellent job. So you want to think in those terms, like, okay, if I had a little less time than somebody else who was full concierge, what could I do to streamline my process so they're still getting like really wild results? It's just something to think about. Then for the outcome, I know you said comprehensive weight loss, comprehensive services and all of that, but somebody was talking to her girlfriend at a birthday party. And it's like, man, I have tried every diet there is, and I can't get this 50 pounds off. And the other person is like, are you really, you haven't heard of Dr. Golden? You should go there because, what did she say?
I mean, I would say just because she's, understands the problem, treats it, like a disease, and I don't know. I guess I'm not sure how to
Yeah, I mean that's
answer that more
true,
than,
but she probably will say, I had 4 days, she helped me get it off. You know what I mean? Like she say she helped me lose weight. So because again, remember, it's process versus outcome. They're two different things. So you want to think in their terms. When your people keep coming back, your practice is 80%, 80% on the obesity weight loss side for a reason. Why do they keep coming back? Right. And sometimes in your clinic, you can ask them, like, so how has this changed your life? What's going on now? And listen to their words. That is like worth its weight in gold. No pun intended at all, but it's like, right? But it's what they tell you is like the best marketing message, right? So start listening to that. Very different from how we think, right? Okay. Again, so this is for everybody. Start listening. When people are like, you're amazing, we think is because I spend more time in the room with them. I do this, I do that. And it may as well be that, but that may not be what they're thinking about at all. They may just be thinking, I tried every diet, it didn't work. I met Dr. Golden, I got it off. Yeah. And if you hear them, I guess it just seems too simple for that to be the answer. Okay, so beautiful. I'm so glad you said that. That they lose weight. Simple is what makes business work. Just like it simple. Right. And so sometimes there's that temptation to make it cute or to make it complex or to make it clever or to make it, like a comprehensive talk. But that's not what sells. A confused mind doesn't buy. A tired mind doesn't buy. We just know what we want. And when we see what we want, we pay for it. You see what I'm saying? So for everybody else, simple is actually good. It's good. So start thinking, start listening to what they're saying. They're telling you what they want to hear. Everybody here, your ideal clients, when they're talking, they're telling you what they want to hear. We do not, marketing messages don't come from us. We can't write good copy. We listen and we say what they said, right? Even with your social media, if you listen to what they're saying and you narrate that on social media, people are like, I needed to hear that today. This was the best ever. But you got it from them. We don't have the marketing message, they do. So I keep saying it because it's a very different way of thinking. But you start thinking, you will never run out of content. And you interrupt the conversations they're having. You start getting, I needed that. How does she know? She gets me, right? And that's what you want to hear. That's what you want to hear. Okay. All right. Very good. Very, very good. EBS approved. Absolutely love it. Love, love, love it. All right. Who is next? Dr. Ngozi. Okay. You're up. Let's do it.
Oh, hi, everybody.
Hi.
So let's see. Hi. I have two practices. I have a primary care practice, which is profitable, and then I have an aesthetic practice, which is the one I'm trying to scale.
Okay.
So that's the one I'm going to focus on. So my business is aesthetic practice. I serve age 18 and up. The problem I solve, I would just say aesthetic needs, which would be, for example, wrinkles, pigment issues, unwanted hair, et cetera, et cetera.
Okay.
The outcome I think I'm going for is to have my clients feel beautiful. And my business model is I basically take cash, fee for service.
So cash?
Yeah.
Okay.
Service,
All
yeah.
right. Beautiful. Now, just a quick question, because you were so on it. What are you doing to market this practice?
That's a good question. I think that's part of the problem. So we have a website. I started making videos, but I could do better. I started, because with the primary care practice, we have a lot of foot traffic that comes in the business in itself. So I'm also targeting there, where now I have flyers and we have questionnaires that clients fill out. So I'm also trying to target the clients that are coming through. But I think here's the issue. I think for me, it's the primary care practice. We did very well with it without social media. And so with the aesthetics, it didn't work the same. And I think that's the problem that I have. And I'm realizing that I need to do something different.
Okay.
So that's what I'm working on.
Okay.
Is marketing.
Okay, beautiful. Now, I did a training that is in the private podcast. It's called the Revenue Generation Framework. Okay. It went live last night. And so for everybody, that's one to listen to. And I just talk about how to take care. It's really, in essence, how do I take people from they have no idea who I am to they keep coming to me over and over and over and bring in all their friends. That's literally what that framework is. And so you can take a listen to it. It would be helpful for everybody. It would just show you how to have this overarching view of your business. It's like liquid gold. Okay. All right. Beautiful. Good job, Dr. Ngozi. You're going to get it done.
Thank you.
Yeah, absolutely. Okay. Who's next? Dr. Teresa. Hi. Oops, where did you go? I just saw you.
Hi.
There you are.
So I'm an adult private practice outpatient psychiatrist. I mainly focus on treating folks who have treatment-resistant depression and PTSD, who've tried multiple therapy and medication options and have failed. We offer innovative, out-of-the-box treatments that are not offered anywhere else in the state of Ohio.
Okay.
And the outcome is having patients participating and functioning in their lives again, and their jobs and their relationships, feeling better, obviously, and not just like punching the card, so to speak, just automaton and just going through the motions. Thriving instead of surviving, but that's been used too much. So I need to work on my marketing, obviously, but my my platform is fee for service, and based off of our original class, I am working with a techie guru to get our podcast up and running. And it's going to be called Psych Waves, in the hopes of being sort of on the leading edge of, you know, what's up and coming in psychiatry and mental health. That's going to be one half of it. And the other half of it is how you can feel better, get the most out of your treatment, and do self-care and do the most that you can do and take responsibility for yourself and feeling better in addition to obtaining treatment.
Man, okay, so let me just tell you this, right? When you started talking, I almost teared up because what you do is so unbelievably, crazily valuable. Okay, I just, okay, I need to check something real quick.
Can I just say something?
Yes.
I feel the same way, Dr. Una. Dr. Anderson, you are needed. Please.
Yeah.
You are so needed. I'm like loving your business. I want it in my area. I will pay money.
Yeah. No,
That's why I'm here, to figure out how to scale things up. The hope,
seriously.
my ultimate dream is actually to offer more holistic mental health services. I hope one day to be like the previous doctor who had her own real estate and set up sort of our own brick and mortar, and where we can have like movement practices and meditation practices, yoga, tai chi, qigong, nutrition practices, and also like float tank therapy, because you can reduce your cortisol level in 3 1-hour floats as opposed to using medications, hyperbaric oxygen, like all the things that are useful and medically relatable, but maybe people are afraid to come to a shrink. And so we want to offer like top-down services and then bottom-up services too, to kind of get us to where folks need to be.
Yeah. Okay, woman. So this, you have me working on stuff behind the scenes. If you hear me clicking, that's what this is. All right. So there are 2 things I want you to do.
Yes.
In your portal, like when you signed up for the business school, you'd have had a Kajabi login thing. There is a masterclass called the Profitable Podcast Masterclass. So I want you to listen to that before you launch your podcast, because that's the way people do podcasts as a hobby. People do podcasts as labor that does not grow their business. And some people do podcasting to grow their business. Okay, so I don't talk about the tactics. I don't talk about what microphone or any of that, but I show you how to build a strategic podcast that directly leads to business growth. Okay, so I want you to listen to that. And then the same training that I talked about last night, the revenue generation framework, I want you to, because that's the revenue generation framework is all about marketing, but in a strategic way, like end to end. Okay. So I want you to take a look at that, see your practice through that lens, and then a lot of stuff will make sense. Okay. But those 2 trainings would be wonderful for you. Okay. Wonderful. But you're like all kinds of approved. I love it. And then again, like everybody else, you're going to start paying attention to what your people are saying. What are they saying? You changed my life. What are the stories, right? Because you can pull from that. And in your podcast, you can do interviews with them. I mean, like you can do all kinds of crazy stuff. So just listen to those 2 things. It'll be game changing for you.
We had one lady who actually did a I don't know what you got, testimonial, I guess, on our website. And she had actually tried every treatment known to mankind and actually didn't want to do our treatment and wanted her husband to save money for her funeral because she was planning on committing suicide. And in 6 weeks, she planned a second honeymoon with him to the Bahamas.
Well, there you go. And that's a story that you tell all day, every day, and 7 times on Sunday, right? And sometimes people are like, well, I've said that before, to which my answer is this. What do you think that the pastors preach about on Christmas Day? It is the birth of Jesus every single year. And guess what? People still show up to church to hear the story they know they're going to hear about, right? And so don't worry about having said it. It's a powerful story. You do it again and again and again, because that one story can explode your practice. And this is for everybody. You find that story, you beat it up. Right? Get more stories, beat them up, but you tell them and tell them and tell them and tell them. So good. Love it. Okay. EBS approved, like all the way. Okay. Who is next? Dr. Terry. All right. Talk to us.
Hi there. I'm sorry. I always have IT issues or coming late from work when I join.
You're
So
at work.
I,
Talk to us.
anyways, I'm a pediatrician trained in integrative medicine. And I've had this business idea on my mind for years and I just can't get it off the ground. So that's why I'm here. I would like to teach adolescent girls, high school and college age, how to master their anxiety and have at hand resilience tools to manage their anxiety on a daily basis, and then to form habits. Because I've gotten my patients to do some of it, but they don't continue doing it. Okay. So my thought was a 4 to 6 week virtual group class. So there's going to be, learning and understanding about your anxiety and your worries and your fears, but then, tackling it with just I think of it as a cafeteria style. You can do this mind body technique. You can do this physical technique, whatever, but then you'll pick it. And I was thinking of teaching one thing per week and having the group, do that. That's your homework for the week, because you need 21 days to build a habit. You need to attach the habit to something that you like to do. So working on all that. So who do I serve? This was the question last week. I serve adolescent females, high school and college, but who is my client? It's actually their mothers who are going to find me.
Yes.
Right. So that was a huge revelation last week. Thank you. What is their primary problem? What teenager do you all know that doesn't have anxiety right now? It was bad before COVID. It is awful now. And I can't get enough. And I don't want to replace the therapist or the pediatrician or the psychiatrist. Here, I really want it to be like, here are the things that we can do, that you can do. Pick something from the menu that you like and make it a habit so that it's ready at hand for you. And have a support group so that there are other people like you and you're not the only weird one out there with this exact same problem, right? So their problem is anxiety, fear, worry. It's keeping them from being their best self. So I want to help build self-esteem and empower them. But these are kind of two, I don't know. I don't like those terms as much. And what outcome do I offer them? Tools to manage their anxiety daily, empowerment, self-esteem, and building a habit that you actually keep. Okay. What's my business model?
So remember, your outcome is how their life looks on the other side of working with you.
Okay.
Right. So that would look like confidence, high self-esteem, in control of their anxiety, like stuff like that. Right. Yeah. So again, that's the way you want to think about it. And then you also want to pay attention to what they say. Right.
Right.
Yeah. Okay. So very good. I didn't mean to interrupt, but I just want to make sure we because it's a different way of thinking. I know we'll say it a few times and then we'll get it. So it's good.
Okay. So I like that confidence, self-esteem, and to be in control of your anxiety. I mean, it's there, right? It's not going to go away. So how do you master it? And instead of it mastering you?
Yep.
What's my business model? I think, so there's a short term. I think I'd like to start it out as virtual classes with, I don't know. I don't know what's the ideal size. I'm thinking somewhere 5 to 10 for 4 to 6 weeks of sessions virtually. At first, I thought you had to do it in person, but then I talked to some of my anxious teenagers and they're like, no, I would so more talk if I were on a video screen. Why would I talk about my life with somebody in person sitting there with me? Because I thought everybody was tired of this video stuff.
We're not tired.
And it was my aha moment from one of my teens. And she's like, no, I talk if we were like this, but I wouldn't talk to like new people that I didn't know in person.
Okay. So this is really good. It's really, really good. And I think anybody who deals with kids knows that this is really needed. I was just talking to my friend who's a pediatrician who is like, I feel like I'm behavioral health now. I feel like I should go do rotation psychiatry and just kind of change what I do. So
Yeah.
it's really, really needed. Again, this is why it's so important to amplify the voices of physicians. Do you see all the things happening? Like there's 13 of us on this call. Listen to what's coming out here. So we just need to become proficient at putting our voices out there, become proficient at dominating the space with we're here and you've been looking for a solution and we're here. You have to become able to articulate the value we bring, articulate the problems our people are having so they can find us, because this is amazing. It's absolutely amazing. All right,
So
Dr. Sarah.
So I have one last question. So who I'm serving are the girls, but I have to get to their mothers. So this was my thing. I was going to do podcasts, as part of my marketing, but then am I doing, teenagers don't listen to podcasts. Adults listen to podcasts. Teenagers look at TikTok.
So
that was a question.
In the beginning, you don't have to pick a platform. In the beginning, you can experiment on other people's platforms. So what that means is you can go be a guest on podcasts. You can do some collaborations with people on IG, Facebook, or you can do YouTube. You can, you can do some TikTok. You can play around with it, then decide on a platform. Right? So if somebody's private practice, I'll probably be like, go do YouTube or a podcast already. You already have an audience, link them in, but otherwise you can experiment. There is a company, they are called Meet Edgar.
Edgar?
There's a social media scheduling type app. That's the way that's how they started. And they wanted to do podcasts. And what they did is they did 52 podcast episodes as guests over the course of a year. So that person is doing as many podcast episodes as someone who has a podcast. You see what I'm saying?
Okay.
And they put their business out there. It led to massive growth. I think they went like boom to 4 million their first year or something crazy. It wasn't their first company, but still. And that was the strategy that they used. So if you're here, you're kind of like, I'm not sure, I'm working this out. Understand that experimenting is part of the business process. And you can experiment in a profitable way. Right? And so you can go be on other people's platforms. You don't have to feel the obligation at all to start a platform right away.
Okay, thank you.
Yeah, absolutely. My pleasure. And that was a great question. Okay, who is next? Dr. Anita, let's do it.
Finally, first of all, sorry, I think I got late here somehow. I was in the hero rally and then I did not know if I had to come back.
So you're here now. You're here.
Okay. So yeah, I did kind of had this. So I'm an oncologist and my business idea is, I started my cancer care clinic, which I also added another, cancer prevention, which is not part of an oncologist job at the current scenario, with oncology being such a heavily, cancer chemotherapy that's our 90% of the role. We usually do not even do survivorship. There is barely any small community hospital or clinic which is doing survivorship, which is also a cancer prevention. So there's a lot of things that are missed, which when I was a full-time oncologist or working for other county and everything, I always felt guilty of something that I was not serving. So my business idea is start a kind of a fee for service, but also add some insurance that I'm doing it. It's just, I'm not clear there, but cancer care clinic with some integrative oncology as well as cancer prevention as part of the clinic. I would like it to be mainly cash pay, and that's my challenge. Oncology with cash pay, it is something that is not very well taken. So it's insurance and Medicare as it comes. One insurance like Blue Cross Blue Shield, and then Medicare, because most of my patients are elderly. So I'm like literally referrals come to me and I have to take Medicare. So that's where my business idea is. And the people that I serve is obviously cancer patients, which by giving them individualized more attention than just a conventional oncologist who barely even listens. I have had some patients where I have taken some second opinions for them, and I have given them an hour and a half, just because this is how I want to do it. And they have literally said, I don't know from which world are you from, but to give me so much of time and attention. And I have done so much of changes in their oncology services, what they were getting, which was like outdated. So I know what I'm doing, but yeah, the kind of people that I reach is very limited because I don't have a chemotherapy bay. I am looking into something more like, hematology as well and oncology, but more on the integrative side where I think prevention should be big. And if it is coming from an oncologist, I do believe internal medicine doctors are so busy right now. I don't think so. They want to talk about, you know what, let's do cancer prevention for you this visit. I've never heard of anybody. It's just like mammogram, colonoscopy. Are you up to date with pap smear 3 test? This is not prevention. This is just a secondary prevention. I want to deal with primary prevention as well as tertiary prevention. So all 3 prevention strategies with integrative medicine, oncology as well. And I don't know if I need to have another fellowship on top of what I already do. I am triple board certified and I do not want to have another 2 years invested in fellowship.
No more fellowships, woman. I mean, we'll do it later, but right now, let me rephrase that. You don't need to do that to do what you want to do. You can, of course, you can do it if you want to. So I guess my question for you is this. Is your ideal client somebody who has cancer or someone who has the risk and then you're working on prevention? Who's your person?
So it's such a good question and I'm still confused, but if I have to choose, I want to choose those at risk patients.
Okay.
Because for me, my commitment and my passion is reducing the cancer risk and getting those people ahead of time so that conventional oncology, there are too many people who are doing it. 70s people are doing it. 80-year-old oncologist is doing it. But once a cancer patient is always at risk of getting the cancer back. So that's where I think as a young oncologist who want to get the integrative part inside, imbibe that, I want to really cut short that risk prevention. And that's where I'm being challenged by and I do a lot of blogs. I am very active on Facebook and social media and some TikToks.
Talking about this?
Yes, I do a lot. Like I realize that marketing is a very important part. So I'm invested heavily into just the Facebook. I think I need to do maybe on Google as well because I'm still not able to get a lot of patients.
Well, but so I think what you need to, again, this is for everybody. I'm probably going to keep going back to it. The revenue generation framework. It will be in your podcast, the private podcast, EBS to go. It will be dated yesterday. Okay. The thing is this, everybody who's spoken here, your ideas are very valid, but it's going to require you owning them, kind of burning a bridge. When I say burning a bridge, I don't mean burning streams of income. I think last week I said I don't like burning stuff, right? But what I mean by that is committing to it, owning it, saying, this is what I'm going to fix. I'm going all out and making people pay attention, right? Like, so in the Entree Method book, I was like, I was quoting John Lee Dumas. He says, when you build it, they will not care until you make them aware. Because I mean, we're all physicians here. How many of you are going like cancer prevention? Yes, please. Like, can you do what you're talking about already? We're all like, do it, right? So your model works, okay? This works, but you're gonna own it. You're gonna do the work. You're gonna not take no for an answer. Let me give you an example. It will help this. When I started talking about this EntreMD thing, I started talking about this in 2016, 6 years ago, pre-COVID, pre all of this. So I would literally be talking about it. People are like, you're nuts. Doctors will always have jobs. We will always be in high demand. People in emergency medicine are like, there will never be a time where anybody can replace an EM physician because what we do is so complex. I'm like, guys, listen to me. It's going to be a bloodbath. It's going to be ugly. But the question is, with your mission, are you willing to stand and talk until people pay attention? Because you're so convinced. I was so convinced of what is happening today. I saw it 6 years ago, right? You've seen, so everybody here, you've seen something and you're like, guys, we can fix this, right? So own that thing because it's valid and our world is depending on us to fix it. Okay, so Dr. Anita, your stuff it rocks, okay? And for everybody else is that thing of owning that voice. And that's why I'm sending us back to the revenue generation framework. We're gonna sit on it. We're going to put our names out there. We're going to put our voices out there. We're going to make it work. Okay. So I love what you do. And it's 100% valid.
Okay.
Right. And I didn't even think of the second generation one. If you had a cancer, then you're always at risk for. So, I mean, like, they're like thousands and thousands and hundreds of thousands of people that you can serve, right? And so knock yourself out.
Wow, thank you so much.
Yeah,
Like,
totally
will give you
legit.
yeah, a simple example. Like somebody on the Lady Docs posted, "Hey, I have a 37-year-old female who is done with her breast. So 44-year-old who's done with her breast cancer. You know everything when she was 20 something, and now she's back. Who do I send her to?" So they like Surge Onc, like she had a bilateral mastectomy, but that's like 10 years back. All she needs is a survivorship program, which if she can go to MD Anderson, great. And otherwise, there's no community oncologist who's actually doing survivorship. They were like, oh, mammogram every few years or every year.
They're waiting for you.
That's where I'm like,
they're waiting for you.
Right?
So
Okay.
yeah, the problem you notice the most that ticks you off, that makes you cry, you're designed to solve it. That's why you're mad at everybody else, because nobody's bothered by it.
I am.
Okay,
mad,
so
but-
do your thing, knock yourself
Thank you.
out. You're on it. Okay, Dr. Ann, do you have your hand up earlier and I just missed you? Was that what happened?
I did. That's fine. That's
Okay.
fine. Okay. So following Teresa Anderson, I am struggling. Teresa, you're down in Cincinnati. I'm in Dayton, Ohio, ironically, which is an hour apart.
Look at that.
Yeah. I'm sure there's reasons for this, but anyway, I have been a psychiatrist for 25 years and I am so done. I am in awe of where Teresa's at. I have a 2-year fellowship in integrative medicine as well, and I'm still done. I do not want, I know a lot of what I don't want. How's that, Dr. Una?
Okay.
I do not want much of a patient care model at this point. I am probably where my zone of genius stands has a lot to do with being a guide and an informational hub for looking at things across multiple systems as well as across the field of holistic medicine. That's when I have somebody who is interested in such. If you want to talk about a sticking point that drives me absolutely batty in this culture, it's ADHD. Because ADHD, you can take a checklist and go through that, and it can be underlying symptoms of depression, anxiety, it could be medical issues, it can be a million things, it could be sleep apnea, it's a million things, right? So I actually had somebody the other day, the typical 30-something that, is coming to me and wanting stimulants, and walked away, and he's like, this is the most comprehensive conversation I've ever had with a psychiatrist around this issue, and was willing to listen. Now, do I really want to stake my life into ADHD? Probably not. I'm willing to have conversations around that. I really.
So I have a question for you.
Yeah.
Okay, so let's say this is March of 2023, and you were talking to somebody and you're like, man, I knew when I was getting into the EntreMD Business School it was going to be great. I had no idea it would be like this. And I wasn't sure of what I wanted to do, or maybe I couldn't give myself permission to do what I really wanted to do because I didn't think it was valid, but I did it. What is that? What did you do? No permissions needed. This is what you really wanted to do. Doesn't matter what anybody thought. You did it. What is that?
It involves kind of where psychology, spirituality, and embodiment kind of intersect.
Okay.
It is about putting wellness, health and wellness type information out, and doing more group type webinar type things where I'm working with people in a group setting.
Okay.
around self-actualization type stuff. So around, whether it's self-esteem, confidence building, mindset stuff around people having difficulty getting to where they want to go, and exploring meaning, purpose, and values.
Okay. So the people who you helped, when they came to you, what did they tell you their problem was?
Probably a bunch of, ironically, probably a bunch of what I'm struggling with. Speaking up, having a voice, knowing that your voice is valid, and that whatever crazy path you want to take is valid.
Okay. And who are these people? Did you help everybody? Did you help young women, old women? Like what do you see? Who did you help? Students, doctors, parents, like anybody?
The day that the country shut down, I was focused on doctors, but didn't have a direction as to what to do, because I saw burnout and I saw where we are today happening then.
Okay.
But I think I had contact with you in that year, but still didn't believe in myself that I could even remotely step out on some limb. So I forget what your question is, and I have a dog making noise.
Oh, which people? What group of people did you help?
So I have trouble answering that. It's bigger than, I think it's bigger than just doctors.
Okay.
It's people that are searching. I can't really even totally isolate it down to, I think the issues around meaning, purpose, and values and spirituality is probably more by default women based, but I don't want to rule out men in that, because that still comes to the forefront.
Okay. Okay. So this is the deal, because there are some things that are recurrent themes, and you said over and over again, which are pointers to what you want to do, right? It's very clear that you want to help people who maybe consider, the way I describe it, right? Because that was me at some point, are people that are handicapped, but it's an internal handicap. They can't own their voice. They can't own who they want to become. They come up with ideas. They squash them themselves because they're like, this is absolutely crazy. Why would you even think about that? That's such a stupid idea, right? And you're helping them own their voices. You're helping them find their path. You're helping them become who they are wired to be, right? So that's what you said. Now, the thing about what you do, there are two things. One is that you can start working on this right away, but in the beginning, if you're coachable, what I will tell you is you want to start more with a one-to-one model, not because that's what you like, but that's what will help you uncover what exactly it is you're trying to do.
Okay.
Because the more you do it, the more you're able to identify, yes, this is exactly what I'm looking for. Then you can tell a group, come in here, I will help you do this. It's hard to do it in a group when you're not clear. And it's okay to not be clear. You're clear enough to start.
Okay.
You see what I'm saying? So that's on one side. On the other side is give yourself permission to explore this. What you have here is good enough to start. As you start talking about it, you can do YouTube videos, you can do podcasts about it, as you do it, you'll find what exactly you're trying to say. It will not come by thinking about it. It will come by doing.
Okay.
When I first started what is EntreMD today, it started as Dr. Una Academy. It started with me helping people with personal development. That's what it started with, because I didn't know, but I was willing to explore, right? The more I explored, the more I was like, okay, it's the business thing I want to do. The more I explore, I was like, you got to choose doctors or non-doctors, because when you put them together, nobody's listening to you, right? Yeah. And then so I picked doctors. Do you see what I'm saying? And so you want to be willing to explore. You have enough to start one-to-one, and then explore. So when we're like, oh, go do a YouTube video, don't say I'm not clear, go explore, right? start. You may not know everything, but you know enough to do YouTube. You know enough to teach on, something on self-esteem or something on confidence and all of that. The more you explore, the more you find it. And when you get there, you'll be like, whoa, this is what I always wanted. I just couldn't articulate it.
Okay. So in the process, I took a bunch of coaching classes, and I'm actually in a certification for coaching while I'm doing this with you, which is really exciting in terms of, trying to manage both. And you caught me on LinkedIn. I've already done a podcast, and that had to do with managing expectations around COVID-19, that being directed more to us as a physician group. I like writing. I like putting stuff out there. I, at one point, owned my own practice for 17 years, and it owned me, is what I would say. And 4 of those years was an integrative thing that was completely cash. But I don't want to go back to kind of that model. And I was speaking during that time. I was out in the community speaking. The trick is when you start speaking out there on given topics, you attract, and here I am a psychiatrist, I would attract people that wanted me to manage their hormones. I would attract people that wanted me to solve their inflammation problems in their guts. And I'm like, okay, I'm like about 10 paces beyond my official certification, shall we say, or residency and whatever. And, is that going to cause me difficulty? So that's partly why at this point, there's a lot of information I know on an integrative health level that could be beneficial to people. And there's a way in which I overview and see stuff that apparently is unique. I'm not sure I see it as such, but that's what people say. And I feel like that information needs to get out to the general public in some capacity. So I'm not a neophyte to speaking and doing a bunch of that. I just have, like you said, got to get clear on the message or what I want to put out there. And that's been a challenge. And I think it's an extreme challenge when you're still trying to work and still trying to manage your own burnout while you're trying to do what you're doing. So
but start from now. You have a focus. It's not completely clear, right? So, but it's a good enough focus, right? That's the idea for everybody here. You're going to end up with something that if you came back and watched this video, you're like, I don't believe I was saying that, right? Because it's going to be so much clearer. But at least you can start with the self-esteem, the confidence, the achieving goals, all that. Own that. Just stay on that lane. And as you stay on that line, that lane, you get more clarity. You stay on that lane. Then you get more clarity. Then you stay on that lane. So you don't have to talk about all the things. In your job, if you're doing all the things, that's okay, but you don't have to talk about them because you're trying to build a brand. You're trying to be known for something. Okay. So I can talk about marriage. I can talk about homeschooling your kids. I can talk about fitness. But if you listen to the EntreMD podcast, I'm talking about business. I'm talking shop all day, every day. And that's the discipline required to build a brand where you're in a category of one, where you're known for a thing. So you have something narrow to start with. Just start there. And when you think about it, yep, I know what I'm doing. Because you do know what you're doing, right? You're starting from here and you're working your way to more clarity. And that's the way it is for every entrepreneur. So you're good.
Okay. All right.
Awesome.
Thank you.
Awesome. I love it. Love it. Okay. Dr. Gretchen, I think we got everybody except we saved the best for last. Let's say that. Yes?
I don't know about that. I am here in the hospital tonight. I am on a 24. I'm an OBGYN hospitalist. I have practiced with Kaiser now for 18 years. I transitioned into the hospital probably last year. I am functional medicine trained. I was certified through the American Board of Integrative Medicine before they switched their whole process. So I was the last year before they changed their name. I have been trained as a yoga teacher. I am, and so I actually just certified as a life coach through the Life Coach School last fall in October. And so my business will be life coaching, a coaching business.
Okay.
I don't know that I quite have my little two-liner there, but I sort of have a dream. And I'll give you like my little two-liner that I sort of just made up, although I don't really have a complete niche or anything yet. So anyway, I help midlife physicians move from tired, stuck, and scarce to intentional creators of abundance. My dream is to essentially heal the healers, to awaken the heart of medicine, to really focus on helping us all find, create, establish our inner sanctuary, something that I feel would help us in not only our day-to-day lives, but also with our patients and also with where I truly feel medicine needs to go. And so, yeah, I have a lot of things within that, you know, like the whole perfectionistic kind of tendency, self-compassion, the legacy mindset, and really looking at what we believe about self-care and self-compassion. So I'm not very focused yet, but I do have a dream.
No. I think, okay, so no, because you know your business.
Yes,
your business is life coaching.
for sure.
Your ideal client is a midlife physician. The problem is they're tired, stuck. Why did I write scared? That's not what you said. Is that what you said?
Scarce, just like the
scarcity mentality.
Yeah.
And then creative abundance, business models, coaching. No, you have it. You have it. No, you do. Now, for everyone who's here who's a coach, I want to give you a bonus thing, okay? And that is this. Yes, you're a life coach. Yes, you may give people outcomes that seem similar, but you still want to stand out amongst life coaches. And the way you do that is you own your story, right? You own the stories of your clients and you say what you do. Because, right, so we there's a language called coachinese, right? And it's a universal language that coaches would use. You want to say what you do, right? So if you're talking about here, you said, you know, legacy mindset, what is that? Talk about it. Self-care, talk about that. Self-compassion, talk about what it is. Tell stories about it, unpack it, right? And what it does is it puts you in a category by yourself. So when people are like, there's so many coaches, they can't lump you in there because you differentiated yourself. Does that make sense? So that's just a bonus you may need 5 months from now, but I thought I'd throw it out there now.
Yeah, you know, one of the things that has really drawn me to coaching is, I mean, obviously from what I sort of led with, I've been interested in the integrative aspect of things for a long time. I'm a long time, you know, practicing person in the spirituality realm and self-growth and everything like that. So, you know, coaching really helped me with a tangible way to incorporate all of those ancient teachings that I love into my daily life. Because I'm great, I can absolutely channel my inner Eckhart Tolle or Thich Nhat Hanh when I'm in yoga class or on my meditation mat, but it becomes a lot more difficult when I'm, you know, on labor and delivery and I have 10 very sick patients, or, you know, I'm asked again for something else from, you know, the upper people in Kaiser, you know, that's not really an ask. And so it becomes a lot more difficult. And so what I have learned is how very important it is to look inside our own brain, to process our feelings, to, you know, look at our thoughts and understand what they actually are. Because I really feel like we don't learn that. We don't learn how to look at our brain. I mean, maybe the psychiatrists do, but I don't know that I ever really looked at what I was actually thinking. So
yeah, Teresa's like, no, we don't. And she's a psychiatrist. So there you go. Yeah.
Yeah.
So, no, but
anyway.
what you do is amazing. I hope you didn't perceive what I was saying as criticism, because that's
Oh,
not.
no,
what it
not,
is.
oh gosh, not at
Yeah.
all. No, I was just telling you why I am drawn to it. And
Yeah, absolutely.
yeah,
Absolutely. Absolutely. I mean, it works. Absolutely. You know, so I don't want you to think you don't have clarity. I think for everybody here, you hereby have clarity. You have enough clarity to move forward. As you move forward, you'll become more clear. There's no more clarity that comes in waiting. Okay, it just doesn't work that way. It's kind of like driving. You can't become a good driver till you drive. It doesn't matter how much you study. It doesn't matter how many driver's tests you pass. You got to drive. Okay, so when okay, so let me put this in gallery view. Does everybody feel like, okay, I got a business I'm going to work on, right? Things may still, there may be some fuzziness, but apparently it's okay. As I take action, things will become clearer. How's everybody feeling? Yeah, feeling like, okay, beautiful. So this is the reason why I didn't add you to the group. I didn't want you to get this whole, fire hose, water hydrant of information, and you don't have something to throw it at. Now you have something to throw it at. You have your business to throw it at, okay? So what's gonna happen next is on Monday, you guys are gonna be added to the main Facebook group for the business school. When you're added, please do not lurk. Okay, I'm an introvert, I get it. Please do not lurk. The community is as powerful as anything else that happens in the school. So I want you to take full advantage of it. So when you go in there, do a picture post, introduce yourself. We'll give you guidelines like what questions to answer and everything, but this is who I am. I'm excited to be here because all of that. The people in there, I promise you, are supportive. They're waiting on you. They're waiting to support you on your journey. They're waiting to learn from you, right? There's not going to be any newbies. You're only allowed to be a newbie in these first 2 weeks. That's why you have the 2 weeks with me. And then when you get in there, you already know the lingo. You already have your business. You are not a newbie. Okay, so when you go in, I want you to show up. If you have questions, I want you to ask them. You're going to get access to trainings and all of that stuff. Take advantage of them. You're going to have the opportunity to feel overwhelmed. I know we talked about it last week. I will say it again. You're going to have the opportunity to feel overwhelmed. You're going to have the temptation to go like, I quit. I can't take this anymore. When those feelings come, remember I told you about them. You're like, she told me about you. Welcome. Bye. Okay. So when you feel overwhelmed, remember this is a strategy. I feel overwhelmed. I can't do all these things. What is the next thing I can do? Do that. Throw everything else away. All right. It's the same thing when a doctor's running a code. There's a system. There's an algorithm, right? We don't worry about all the things. The next thing that should happen is this. Then the next thing, that's why the doc looks calm, while everybody else is losing their minds when a code is going on, right? Why is he not overwhelmed? Why is she not overwhelmed? I just need to focus on the next thing. So please do that for your business. Don't fall into that trap. If you are struggling, the EntreMD Business School Facebook group is not a place of toxic positivity, which means when we have wins, we celebrate them. When we have challenges, we come out and we say, I'm struggling with this. And there's a way to do it that's not negative. It's not like, this is not working, I hate this, right? We're not going to do that. What we do is, I understand I want to start a YouTube channel because I think this is the next thing I need to do with my business, but I'm really struggling with this aspect. People will come out of people will even volunteer to get on the phone with you. Okay. So it's just like, I need help with this. Understand that your business is always working, even when it looks like it's not. It is always working. So when you feel like, man, this is going crazy, what's the next step? Let's do that. Okay. If you listened to all the business ideas represented here, you want all of them to work, don't you? You're like, man, she should do that. She should, right? You want all of them to work. Why? They're amazing. But they're like newborn babies, right? And so newborn babies are not in cruise control. It's kind of like, you got to change the diaper, you got to burp, the baby spits up on you and all this stuff. So, there's a little messiness to it, but the baby's still growing. And the baby's still going to show up in kindergarten. And you're going to take those pictures in middle school. Like the baby's still growing, even though it's messy in the beginning. Okay, so I'm just saying this because I really love every business idea represented here. I'm really rooting for you. I can't wait for you to go like, Dr. Una, you will not believe what happened. And I'll be like, yes, I will. Please tell me what happened. Right? I don't give up on it. Entrepreneurship has its hard sides. And that's why we built a community. So you don't have to do it by yourself. I'm not going to lie to you and say, walk in the park. It is, nothing is. We're old enough to know that nothing is. Nothing great is. But that's why you have a community. That's why you have weekly live sessions. That's why you have live events. That's why you have all these things. Take advantage of everything. Own your vision. It's legit. And it will change the world. It will. Okay. So, all right, people. I will have for the Facebook group, I know a number of you recordings. I will put this, I will email them to you. That's what I'll have Makita email them to you. So you have 2 links, YouTube unlisted videos. So don't share them. Yeah, but they'll be unlisted. What was I going to say? I don't remember. The question kind of took it off. Yeah, I don't remember what I was going to say. Okay. Oh, the Facebook group. So a number of you have already sent in requests to be added to the group. If you havenent done that, you can just look for EntreMD Business School and request to add. We won't add you till Monday because we'll add you all at the same time. And, you know, you can go there, you can do your intro post. Everybody will come out, welcome you, make a lot of noise, and then we'll take it from there. Okay. Any other questions before I let you guys go? I'm so excited for you guys. You have no idea. I'm just not doing cartwheels because I'm 43. I don't do that anymore, but I'm that excited. And any other questions? No? Okay. Okay. So I'm going to let you go. So those 2 trainings, you can go, you know, listen to them and all of that stuff. We'll see you on Monday. And then we're going to hit the ground running. We're probably going to do a session on hiring. You'll love it, even though you'll love it. Love, love, love it. Okay. All right, people. Good night. Oh, let's do a picture. Let's do a picture. Dr. Lena and Dr. T, can you come on camera? Do you think you can? If you can, that's okay. Okay, we have Dr. Lena. Dr. T, are you able to come on? We're going to look back a year from now and laugh. We're going to be like, oh my gosh, do you remember then? Yeah? Okay, maybe she cannot come on. All right. Big smiles, everybody. Oh, she's on now. Okay, let's do it again. Big smiles. All right, I got it. All right, good night, people. I will see you on Monday. Super excited, okay? All right, bye.